Let's talk about birth control pills in the treatment of acne. I'm Dr. Dustin. I'm a board-certified dermatologist, and I treat a ton of acne in my clinic. So today we're going to dive into the 3 different ways that oral contraceptive pills could actually help to reduce the appearance of acne. We're also going to touch upon the different types of birth control pills that are effective for acne, as well as those that might actually make it worse. I will explain to you which patients are most likely to experience a benefit in using oral contraceptive pills for treating acne and who might not see as good of a result. And then we're also going to talk about the potential risks, side effects, as well as how long it's going to take to see results. So if that's of interest to you, stick around and let's get into it. Now, birth control pills were first developed to prevent pregnancy, giving women more choice over their reproductive freedom. Over time, it was discovered that they could reduce the appearance of acne, so as time went on, the FDA actually approved several different types of oral contraceptive pills specifically for acne. So it is an indication alone in and of itself that you can use birth control pills to treat acne, even if somebody is not interested in preventing pregnancy. Obviously, if they're taking them, they're not going to want to get pregnant, but it's not necessarily the primary reason that they might be taking it. Basically, I'm saying that you can take these things for acne, even if you have no intention of being sexually active. So we need to understand how they might actually help to reduce acne. First off, especially in teenagers and adult women, we see a lot of hormonal acne. And when we look at the hormones that lead to acne, they're primarily androgens, things like testosterone. So one of the things that oral contraceptive pills can do, especially those that are combination pills, meaning they have estrogen and progestin in them, is that they actually help to reduce the amount of circulating androgens in the body, just because of the feedback mechanisms in the body and the way that things work. Now, the oil glands in your skin are sensitive to androgens. When the androgens, things like testosterone, get to the oil glands, they turn them on. They induce them to lead to more oil production, which could cause plugging of the pores, feeding the bacteria that cause acne. And so when you have lower circulating levels of androgens, your oil glands are not as active, and oftentimes you'll have less acne appearing. So that is the first way, is that a reduction in androgens can happen by using oral contraceptive pills. The second way that oral contraceptive pills might be helpful in the treatment of acne is simply a regulation of hormonal fluctuations. Many women, especially adult women who are coming in with hormonal acne, are noticing that their acne, particularly that around the chin and the jawline, flares around the time of their cycle because there's wide fluctuations in the amount of hormones in the body, estrogen and progestins. So when somebody is taking an oral contraceptive pill that is a continuous pill, where they're not taking a placebo pill for part of the month, they're not going to have those wider fluctuations in hormones. So if your hormone levels are steady 365 days a year, you're not getting those larger spikes or dips that are going to change and affect the way that your skin is responding. And the third mechanism whereby oral contraceptive pills can help to reduce acne is that they do in and of themselves have a slight anti-inflammatory effect. A lot of acne starts with inflammation in the skin, and if your skin is inflamed, you're going to have some swelling there, and you might just plug up your pores and lead to more acne. So those are the 3 main mechanisms by which oral contraceptive pills can help to reduce, can help to treat acne, and that is the reason that we use them in dermatology. Now, I would say in my own practice, it's not something that I do a lot, but in certain circumstances, we do prescribe them, particularly if a patient requests that. Now, there are specific pills that are approved for acne, as we mentioned. The most common brands are going to be orthotricycline, Yaz, and Estrostep. There are others, and there's others that have the exact same ingredients, just at different concentrations, that have not necessarily been approved for acne, but because they have the exact same active ingredients, can also be used. It would technically then be an off-label use by the doctor, but it's completely fine to use them in that manner. All of these pills that are approved for the treatment of acne are going to be combination pills that contain both estrogen and progestin. One thing that I see in my clinic is that patients will sometimes come in on something called a mini pill. This is a progestin-only pill, so there is no estrogen in it. And depending on the type of progestin, because there are different types of progestins that can be put in these medications, some of them can help to reduce acne, but many of them actually cause more acne, lead to more androgenic activity, and can actually make acne worse. So I have seen patients come in on the mini pill, the depot shot, the Implanon, even the IUDs that elute progestin, things like the Mirena. I have personally seen patients that had those, and then 2 to 6 months later, their acne just explodes. This doesn't happen for everybody. It is an individual case-by-case response, but those are things to be aware of, is that if you're seeking out birth control pills and you have acne, it's better to go with a combination pill, and you're likely to not get a flare of your acne, and it might actually get better. So now that we know what the mechanisms of action are and what kind of pills are going to be better for acne, let's talk about who is the right patient for this. Who would benefit the most from taking oral contraceptive pills for acne? This is primarily going to be patients who have the more hormonal distribution of acne, as I mentioned, along the chin and the jawline. If you see that your acne flares around your cycle, you're much more likely to benefit from the use of oral contraceptive pills in the treatment of acne. Women with polycystic ovarian syndrome are another group that often have irregular menstrual cycles, and they have wide hormonal fluctuations, and those are great candidates in many cases to treat with oral contraceptive pills if they're dealing with acne. Generally, the oral contraceptive pills are also used for women with more moderate to severe acne. If someone's coming in with very mild acne, we generally don't put them on any oral medication. We try to treat that just topically to limit or reduce the amount of side effects that they might experience. So these are often going to be patients with hormonal problems, like polycystic ovarian disease or significant fluctuations in their acne around their cycle, and those with more moderate to severe acne, not those with mild acne. Now, while all of this may sound great in the treatment of acne, oral contraceptive pills do come with some risk, and so it's important to discuss those with your doctor or with your gynecologist or primary care physician, whoever it is that's helping to manage your contraception choices and your acne. Some of the more common side effects that women have experienced when taking oral contraceptive pills might include nausea. Some complain of weight gain, some complain of breast tenderness, and certainly some complain of mood swings when taking oral contraceptive pills. Our hormones have a huge impact on the way that we feel, and so if you're taking exogenous hormones of any kind, it can have an impact on that. One of the bigger risks to consider is that oral contraceptive pills have a slight increased risk of blood clots. Now, the risk of blood clots from oral contraceptive pills, although it's greater than those in the general population who aren't taking any medication, it's still much, much lower than women who are pregnant. So getting pregnant actually significantly increases your risk of developing blood clots, but it's still a non-negligible thing to understand that oral contraceptive pills can increase your risk of getting blood clots. This is going to be a lot higher risk for individuals who smoke, individuals who are significantly overweight, those over 35, and those with migraine headaches that start with an aura. I don't even remember the reason why for that, but it's always been ingrained in me since the time I was a resident. Also, of course, if you have a family history of clotting disorders, there's certain genetic conditions that make you more likely to get blood clots in your legs that could travel to your lungs. Yeah, you're going to have a higher risk of blood clots by taking oral contraceptive pills. So if I have a patient with a history of blood clots in them, or a first-degree relative, or they're a smoker, I don't prescribe the oral contraceptive pills. I let their gynecologist do that. Now, whenever you have acne, you want it to be gone as soon as possible. What are the realistic results in taking oral contraceptive pills for the resolution of acne? Well, the unfortunate thing is with hormones, it's going to take a long time to regulate and get that acne to clear up. So I instruct my patients to plan for about 3 to 6 months. Now, we should see progress over that time, but it's not an overnight fix. It's something, as long as you're not having significant side effects from, then we can be patient. We're going to see that acne decrease over time, but it can sometimes take up to 6 months to see the full effect. So hopefully this has been instructional on understanding the different ways in which contraceptive pills can help to reduce acne, what the risks and benefits are, who's going to be the best candidate for it, and what type of medication in particular is going to be better for acne, and even some of those that could make your acne worse. On future videos, we'll have whole conversations on the lifestyle things that can also impact acne, because I find that more and more patients, as our food supply seems to get less and less quality, and as our stress levels go up and our sleep levels go down, that we're seeing more people break out in acne. And so there's so many lifestyle things that we can also discuss that we're going to leave for a future video. But if you guys have specific questions about this topic or anything else you'd like me to discuss on the channel, leave them down in the comments. And the last note that I'll leave you with is I have a charitable mobile clinic. I got a 39-foot motorhome that I go do free dermatology care in. And if you want to help support that cause and get some great skincare in the process, I have links down in the video description, and they are affiliate links that that we get some revenue from that help to support that mission. So you can check out the same products that I offer in my clinic, and I'll see you guys on the next video.